Hello everyone. So in this video I am going to show the complete set of things what we generally use in our podiatry department. So I think you wouldn't have seen this much footwear and walkers so being used in our podiatry department. So one by one, if I want to tell you briefly, this is front offloading footwear. So if you see this one, there is the outsole is cut in such a way this part front forefoot is offloaded. So if you compare with this footwear, this is hind foot offloading, whereas this one is forefoot offloading. This is mainly used for patient who has undergone surgery over the toes, hallux correction, or a forefoot ulcer. And this one is used for heel ulcer. So if the patient walks, there will be no pressure over that forefoot or hind foot region. This is a wound care shoe. So if the patient has any ulcer over this area, we will take a mold over this insole and then we will cut this portion as well as second and third layer of the insole. Following that, if the patient walks also, the pressure will be minimal at this point so that the ulcer will heal very fastly. And this one is a customized insole. Customized, what we mean, based on the foot architecture of an individual, we'll take a mold and based on 3D computer aided designing, we'll cut this thing, insole, and it will offload most of the ulcer side, and based on the ulcer side we can make scooping of the insoles and give offloading depression also, so that the ulcer will heal very fastly. And this is particularly used for plantar fasciitis or any flat foot or high arched foot. We can mold according to the nature of the foot. And then this one is many of our elderly patients cannot just bend and put inside their foot inside the footwear. They will feel very difficult, and more than the patient, if they have undergone any surgery or something, it is very difficult to accommodate the dressings also. So for that, this has been designed to have a multiple adjustable velcros. So they can just like that put their foot, and without anyone's help they can use that one. So this one is an AFO. AFO is ankle foot orthosis. If the patient is a midfoot amputee, they need support for brisk walking. To that support, this AFO elevated projection will support the leg, and even if they walk briskly also, they won't lose their stability. So all these things are controlled ankle movement walker, cam walker. This has two things: without air bladder and with air bladder, we can inflate the air bladder so that this snugly fix the leg and it offloads the ankle. And this is mainly used for orthopedic patient who was undergoing ankle and tendon-Achilles repair, ankle surgeries, ligament surgeries, or if the patient is having equinus with ulcer on the forefoot. So all these things, this kind of cam walker can be used. Once the ankle movement is limited, most of the wound on the midfoot or hind foot level will heal with a nice offloading insole inside the cam walker. So one such thing is crow walker. Patient with Charcot with midfoot collapse and ulcer or hind foot ulcer. So this crow walker will be useful. The rocker bottom in the crow walker particularly offloads the midfoot and the hind foot area, and at the same time it restricts the ankle also. This is PTB, patellar tendon bearing walker. So with this, the pressure from the patella is taken to the head, thereby ankle is offloaded, and it restricts the ankle mobility also. We can cut on the posterior side so that while the patient is on lying, this heel portion won't get pressure soaked. Again, this one is cosmetic restoration. So if you see this one, it looks pretty much natural. You can see the veins, they have made it in such a way veins are visible, the nail folds, the nail, and the plantar surface also, it looks quite like a natural foot. So this is for any forefoot or midfoot amputee who are much depressed and they want to have a foot which should look normally. So this kind of mold can be inserted in the midfoot stump with the carbon guided support here. So that gives stability, and with the one and with the sandal velcro they can fasten that one and they can walk normally. So all these things. So along with, if you want to show you, this is quadruped. This is kind of offloading thing. If the patient undergone surgery during the post-operative period, they can use this one for their support, and elderly patient for stability also they can use this quadruped, and this has 4 thongs which supports and gives much stability. And this one is walker, so they can give the pressure body weight over the hand and the forearm, so they can just lift it. And they can walk like this. So this is a kind of off-roading thing. And next one comes the wheelchair. Wheelchair, as everybody knows, for elderly bedridden patient as well as elderly patient, they can. But the disadvantage is it requires somebody to take care of them and for mobility also. So all these things what I have shown here are mainly for offloading and elderly patient stability. So that is why the podiatry, the orthotic is very important when it comes for wound healing and podiatry. Thanks for watching. See you. Bye bye.